According to the Centers for Disease Control and Prevention, out of the 45 million Americans who smoke, 70% say that they want to quit completely. And if you're one of them, well, then the little clinic located inside of 5 Kroger stores throughout Memphis can help you kick the habit. And Anna Sheffield is here to tell us more about this. Welcome, Anna. Okay, so the little clinics, tell me a little bit about them.
We are located inside select Kroger stores in this area, one in Bartlett, 2 in Cordova, 2 in Collierville.
Okay.
We offer convenient health care and basically a one-stop type of thing. You can come in the clinic inside the Kroger, be treated for minor illnesses, go over to the pharmacy, get your prescriptions, and do your shopping all in the same place. Okay,
and you just started what's called the SmartPath Tobacco Cessation program a month ago, right?
That's correct.
And how's that going? Are people, well, I'm sure they're probably just learning about it.
They're just learning about it, but we do have quite a bit of interest already. Yeah. The first visit, we do a review of your health history, your health status currently, and your level of nicotine dependence. And based on those assessments, we will recommend medication, counseling, and other ways to help you quit smoking.
Now, what kind of medication can you give to?
It varies. We offer everything from nicotine patches or inhalers up to the more popular prescription medication, Chantix, that I'm sure everyone has heard of by now.
Yeah, and isn't there some kind of controversy, though, going on with that?
There has been a new label placed on that for increased risk with heart disease patients. Okay. So that's definitely one thing that we would screen you for before we recommended that type of medication.
Gotcha. And when people come into the clinic, what do they say to you?
I want to quit smoking.
And then you ask them, how many years have you been doing it?
Yes, they have lots of questions. We have brochures out front on the desk, and a lot of people are just walking by and happen to see the brochure and then inquire about that program.
When they come in and they say, I want to quit smoking, how can you tell the people who really want and the people who think they may want to?
It takes a little time of talking to that patient, and we ask them if they've ever tried to quit before and what methods they've used and why they feel like they were not successful in the past. We incorporate all of that into this program to help make a better plan this time so that they will be more successful to quit.
Okay, and then you said, so the first time you go ahead, you screen them for their health issues and things of that sort, talk to them, ask them questions. You bring them in a second time, and you do what again the second time?
We have a follow-up visit based on what we did the first visit. If we prescribe medication, that follow-up visit, we want to talk about how they're doing with their medication, if they're having any side effects, and also any triggers that they have noticed that makes them want to smoke.
Right.
Stress or being around others that smoke and that sort of thing. And we have coaching sessions. So you can come back as many times as you want for coaching sessions, and we help you deal with those stresses and encourage you to avoid those situations that make you want to light up.
You know, there's a lot of people like in the Weight Watchers groups, things of that sort. They have support groups. Are there any support groups that you all offer?
Absolutely. We have a list of local support groups.
Okay.
And we also encourage the patient to have support within their own family and support network. Of course, it's always harder to quit if you're living with someone that smokes. So actually, I had someone come in the other day. It was a wife, husband, and their daughter. So they were going to do the family smoking cessation. All try to quit at the same time.
Well, that certainly would save them a lot of money, wouldn't it?
Yes.
And I was during commercial break, you know, we were talking about, I think a couple weeks ago or a month or so ago, the new packaging is going to be unveiled pretty soon, where there are very graphic images of people with tracheotomies and things of that sort on cigarette packages. Do you think that's going to deter anybody from quitting?
I think it possibly could. I did have one patient tell me the other day that she would stop smoking when they started putting those pictures on there.
Why when? Did you ask her why when they stopped? Why not try now?
I did. She said she just didn't think she could look at it, and I don't know. I
Whatever
don't know
works,
if that,
huh?
I don't know if that's going to work or not.
Yeah.
I think it will obviously raise awareness of what can happen from smoking.
And then how much does this program cost?
It's $29.
Okay.
The first visit's $29, and the second visit, the follow-up, is free.
Okay.
And then each coaching session follow-up after that is also $29.
And I'd ask you how everything is going, but you just started this a month ago, so you really don't have the...
Don't really know yet. We want to make sure everyone knows about it so that we can offer this for anyone that is trying to quit smoking.
Yeah, it's certainly cheaper than smoking, isn't it?
Absolutely.
Thank you so much for being here. Appreciate it.
Thank you.
And if you'd like more information on the little clinic, you can also go to abc24.com and just click on the Find It link on our homepage.